Hello, welcome to Talking Health with Dr. Laz, your favorite health program on television. We're reaching you from Nigeria's capital, Abuja. My name is Dr. Laz Eze. Yes, we're going to continue our conversation around major organs of the body and, how they function, how we should care for them, and also the diseases that may affect them and what you need to do should they occur. Today on the program, we are going to be talking about the kidneys, their functions, the diseases that affect them, and how you could manage them. And we're going to have a nephrologist. A nephrologist is a specialist doctor who knows a whole lot and handles kidney diseases, be able to treat them, and also, in fact, we just say a specialist in kidney matters. But just talking about the kidney, do you know that, it's the kidneys that produces urine in the body? Do you know that the kidney is involved in the regulation of the body fluid, the water in the body? Do you know that the kidneys also regulate the blood pressure? Do you know that the kidneys also control calcium metabolism in the body, which helps in the strengthening of the bones? Do you know all this about it? You are going to get to know more in the course of the program. So after the break, I'm going to be introducing my guest. I know you can't wait to meet him. But note that this program will also be on our YouTube channel. So feel free to subscribe to Talk Health Nigeria TV on YouTube, and also follow us on our social media handles so that you get to watch it as many times as you want, because they're highly educative. May I also mention that we're going to be projecting some images in the course of the program. Some might not be very pleasant to the eyes, but they are essentially for education purposes, because as much as possible, we want you to be able to visualize and understand how these body systems function and how you're going to take a very good care of them. So we'll be right back after the break. Do stay with us. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Like I mentioned before the break, we are talking about the kidneys today, their functions, diseases that affect them, and how to manage them. And I'll be discussing this with a specialist doctor in kidney matters, Dr. Ade Faponle. You're welcome to the program.
Thank you very much.
We can't shake COVID protocols. So good to see you. The kidneys, perhaps we start from this, but let me mention that Dr. Ade Faponle is a consultant nephrologist at Zenith Medicare and the Kidney Center here in Abuja, and also the kidney doctor, right? That's the popular name, and kidney transplant physician. Welcome to the program once again.
Thank you very much.
All right, so we'll get to the slide and talk about the kidneys, of course, starting from the normal before we get to the abnormal. Okay, so these are the human kidneys. What it looks like. Can you speak to it? Of course, the location, anatomical location in the body and all that.
Thank you. So every single individual has two kidneys. From the shape, we can see it looks like a bean. So we talk about bean shaped. And medical term we will say is that they are the retroperitoneal state. That's just behind
retroperitoneal towards the back.
Towards the back. So you see them at the back there. At the back there, just lower back. So that for ease of understanding. Yeah. Yes. And
let's move to the next slide. I think he has a better anatomy, description of the kidney. Yes. So this is like someone facing the way I'm facing. So you could describe it in relation to the other organs in the abdomen.
And you see, so we can see, at least we can see one kidney in this slide here on the left side, on the left side of the body.
So this one here,
we can see one clearly.
You may feel free to come close. And,
this is one, and then this other one that's not too clear.
Okay.
And we can see other structures trying to a bit overshadow it.
This is the liver.
That's the liver. That's the pancreas.
Okay.
On each kidney we have, it's not showing here, but we have what they call the adrenals here.
Yes.
Yes. So
Okay, I can see something
No,
here.
this is for a patient who's gotten transplant.
A transplant.
Yes.
Okay, so what happens if these kidneys are not functional and there's a transplant? You don't replace it at the same location?
We don't usually have to remove them
Oh,
most
okay,
of the time.
so it
So
can
we'll create
come-
another space here and then keep the transplanted kidney here. Yes.
Okay, and you even have a different
see.
urethra.
Straight down
To the bladder.
Yes.
Okay, so you have the bladder here.
Yeah, you have the
so
bladder
these
here,
are the normal.
and then these are the two kidneys.
The kidneys.
in here.
This is the urethra.
Yes.
No, these are the ureters.
Urethra.
Ureters.
T-E-E-R.
Yeah.
And
So the
then-
urethra is down here, the one
Yes.
that conveys urine outside. Yes, we got most of these images online. Thanks to Mayo Clinic for putting that up. So the functions of the kidney, I mentioned them at the beginning. Perhaps you could speak more to them.
Yeah, and you mentioned most
Produces urine
Well,
and removes toxins and wastes from the
product from
body
bodies.
through the urine.
of them. Exactly. So we can see that the kidneys help to
You
keep
may need to speak
the
louder.
kidneys
Yeah.
help to keep the body in a state of homeostasis. Ensure
Homeostasis, equilibrium.
Equilibrium, yes.
Okay.
So you see that's the essence of, that's one major thing about the kidneys. In terms, hemostasis vis-a-vis acid-base balance, fluid, removal of toxins to keep.
So keep it normal.
Keep it normal.
You don't have excess water.
Exactly.
You don't have
And
excess sodium. Everything is normal. Anyone
And
that
the
is excess,
kidneys
it takes it
takes
out.
it out and
right?
regulates it.
And regulates
Such
it to remain the way
the
it should
same,
be.
the way it should be. Another important point is that it produces the major hormone that makes blood. That's what they call erythropoietin.
Erythropoietin. So
so
the hormones that helps in the production of
kidneys
blood.
make 60% of
Red
it.
blood cells or every type of blood.
Erythropoietin, red blood cells.
Red blood cells.
And to make sure that the blood levels are in the adequate amount of body.
Okay.
Kidneys don't
So
do
the
that.
lifespan of the red blood cells, I think 120 days.
120 days.
So the erythropoietin makes sure that while the blood cells are being produced and they are dying off, new ones are produced.
being formed. Yes.
So if there's problem
Stable.
with the kidney, there could be anemia, low blood level.
Yes, and that's one major symptom that might give you a pointer that somebody might be having kidney disease. I'm sure we'll probably talk about that extensively. When somebody is always having very low blood levels, it's unexplained, and you can't just find
The cause of
of
the-
it.
of the
You
blood
might need
level.
to look at the kidneys.
Okay, regulate blood pressure.
Yes.
Renin.
Yes. Because yes, the kidneys also produces renin, and
Okay.
that's aside even all of that, because of even the homeostasis vis-a-vis fluid balance. Again, too much of fluid retaining so much of fluid, retaining so much of sodium in the body might also shoot up the blood pressure.
blood
That's
pressure.
under. So in about 7 different ways, the kidneys can help to regulate
The
blood pressure.
And keeping the bones healthy through the calcium.
Activation of the major hormone that produces calcium.
Calcium.
Vitamin, yeah, the
Okay, so
125 diet.
let's move to the next. Yes, so this is just showing the
Another
relationship.
diagram again.
So this is similar to the previous diagram, but this is essentially to show the urinary tract.
Yeah.
Because urine is key in the functions of the kidney. So you have the kidneys, when they produce urine, they move through the ureters. There are 2 of them, and they come to the bladder.
Exactly.
So
And then-
when it gets to certain volume, the body gives you signal, go and pass urine.
and then that's where you go and pass
You go
out
and pass
urine.
it out. And
Yes.
like you explained, it keeps everything
in a
normal.
state of homeostasis. That's
Yes,
the
so
beauty
anyone
about it.
that is reducing, it helps to produce to make it up.
Yes.
If it's excess, it helps to.
Yes.
uh,
And
keep it
before
normal.
we go on, let me just say again, as small as it is, I was almost going there. It takes 20% of the cardiac output. That is all the blood coming out of the heart. The kidneys take 20%. 20%.
2 out of 10.
20%. Yes.
So if you have 10 liters of blood in the body
yes,
that the heart pumps out,
yeah,
the kidneys take 2
to
liters
take 2 liters.
to use to do its job.
Yes. And so,
So-
show how important those organs are.
Okay, so that's why when there is a low volume of blood caused by excessive blood loss and
Yes,
all that,
it
the
will
kidney
affect it.
starts complaining.
Yes.
And the person
I'm
will
not
not
getting
make
enough.
urine. So can we get to the next slide, please? Okay, so disease of the kidney can be congenital or acquired. And by congenital diseases, we mean those that someone is born with. So they just deliver the baby and you find out that there are already some conditions. Acquired could be infection, could be trauma, could be any other conditions that we are going to be looking at. So let's get to the next slide. For I think horseshoes kidney is a form of congenital, right?
Yes, congenital. Yes, and so you have small babies born with kidneys like this and grow up with kidneys like this. I should add that it's not all the time that these kidneys, because they're like this, will not do their jobs.
Okay.
They can still do their job.
So a kidney like this can do its
might
job.
still do its job.
Okay.
Might
is there
still,
a situation
of course,
where it may not?
Definitely. Then that's why it's important to know what problems
that's possibly responsible for.
No,
this,
you might
right?
not know. Somebody has been born with this,
okay.
But he should know early enough so as to as much as possible avoid risk factors.
Can this be diagnosed while the baby is still through the obstetric ultrasound? Can you find something, or do you need to do Doppler or any other?
Well, yes, you can make simple ultrasound can make this.
Can pick it up.
Can pick this
Why
diagnosis.
in utero? Why the baby is
not
still in the
necessarily.
womb?
Child has to be born first, and then when you are born,
so
and then done ultrasound. No.
Okay. So let's move to the next before we take a break and continue. Okay, yes, polycystic kidney disease. This is also the type that is inborn. Sorry, this image is just for educational purpose. So, but this is the kidney from here. Can you speak a bit to it and what it could present as?
Autosomal dominant, that's the full term. Autosomal dominant polycystic kidney disease is the leading cause, genetic cause, congenital cause of end-stage renal disease worldwide.
Okay. Yes. So let's take it again.
Yes.
Autosomal dominant means is gene.
Yes, something genetic.
Genetic.
Yes.
So, and because it's dominant means it stays long, because there's also autosomal recessive.
There's also recessive.
Okay,
that might not show, that might skip generations. But dominant, every generation, somebody will have it. There's a likelihood that somebody will be born with it.
Okay.
Yes.
So, and it's the commonest cause?
It's the commonest cause, genetic cause of end-stage renal disease worldwide.
And end-stage renal disease means one that the kidney will completely fail.
Yes.
Of course, looking at this organ, you can see that it's be difficult for it to function in this kind of situation. Let's move to the next slide. I think there's a sort of comparison on the next slide between,
so this is normal kidney.
So this is what a normal kidney looks like, and this is what the one with polycystic kidney disease. So structurally, it can't really function.
Well,
or can it in this state, depending on
anybody born with cysts? The definition, anybody born with cysts, definition says this is chronic kidney disease.
Okay.
So if this is picked early, identified early,
yes,
the CKD strategies.
CKD is chronic kidney disease. Okay.
Whether drug or whatever non-lifestyle strategies have to be put in place to delay the progression.
Okay.
So it doesn't get to end-stage renal disease quickly. And so chronic kidney disease does not necessarily mean the kidneys have failed, because it's a progressive illness.
But it can lead to failure.
It can lead to failure if nothing is done about it.
So in this
anybody
case,
born with this, you should know this is chronic kidney disease. And it has to be as much as possible.
Can someone born with this manage it for life without the kidney?
Yes, there are a few people who have.
Any point?
Yes, there are a few people. That's where nephrologists will come into place to put in strategies to delay that progression to end-stage renal disease.
Okay.
Yes.
Okay, delay, but not completely stop.
So, but it's a function of what the nephrologist is doing, and also whether the patient will also be compliant on his medications.
Okay. All right, Dr. Faponle, we'll get back to this conversation, but let's take a break and we'll be right back. Please do stay with us. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, the conversation with Dr. Ade Faponle, a kidney specialist, continues. So, Doctor, the kidney doctor, as we like to call you. So, let's move. We have essentially less than 10 minutes, and I think there are many other slides. So, these are kidney stones. This is quite common, especially in northern Nigeria, where you have a lot of heat and all that. Can you speak to it, please?
And majorly it's because people don't take enough water.
People don't take enough water?
Enough water. If you take enough water, most times, you will not come down with stones. That's one way first way to even tell in trying to manage stones. Drinking
Is there
enough
any
water.
side effect of taking
Adequate
plenty water?
Of course, too much water is bad. Too little water
what
is
can
bad.
too much water? Because apart from passing frequent urine,
That can be a problem because you pass more urine and then you distort some electrolytes, particularly sodium.
okay.
And that again might not be good on the long term. So too much water is bad. Too little water too is also bad.
What is too much water?
Adequate water means that you are taking 2.5% of your body weight. So perhaps maybe if you are 70 kg in a day, 2.5 or about 3% of your body weight, equate it to how much fluid you should take in a day.
My body weight is 80%.
Yes. So
10% will be 8 kg.
8 kg.
Right?
So, yes.
5% will be 4 kg.
Yes.
2.5% will be 2.
Yes.
Is it in 2 liters?
So it's in terms of your body size. That's why we put a percentage to it.
Okay.
So usually it spans
liters,
between 2.5 to 3 liters in a day.
Okay, 2.5 to 3 liters.
I mean, that covers for
instead of percentages. Okay, so that's fine. So the image at the right actually picked it online from, I think, a China. Is 420 stones removed from one person. That's that image on the right, and this is what it could look like in the kidney. So this can alter the functions of the kidney, right?
Yes.
Can it lead to kidney failure?
Recurrent infections, and then pain. Hematuria,
the
and
pain
then
can be very severe,
kidney
really.
disease at the end of the day.
The
Some
pain
of these
can be very
things
severe.
really might be genetic disorders. Though. You can have people who have predispositions to producing stones, not necessarily because of their own faults.
Water.
Yes, but they have some genetic predispositions.
So if one has that very severe, sharp back pain,
it might just perhaps.
It might just
the commonest stone
this.
are the calcium phosphate, calcium oxalate, and calcium phosphate stones that you have around. So it's just good to be aware because you can have uric acid stones, you can have many types of stones. That's medical. Yes.
Okay, so let's move to the next slide quickly. Okay, hydronephrosis. The left is the healthy kidney. So when the ureters are blocked,
there's an obstruction to the outflow. And so the kidneys, there's a back pressure effect on the kidneys. So the kidneys swell up. And that's
so the ureters are this.
Yes, going.
That conveys urine from the kidney to the bladder from where it goes out. So if there is anything that obstructs the bladder, in fact, it can be at the level of the ureter, it can be at the level of the bladder, or even the urethra.
Yes. So the effect, what will eventually lead to this is the back pressure effect.
So when the water that's supposed to go out is not going out, it's now coming back to the kidneys.
And the kidneys swell up.
So the kidneys will swell up. And that can affect its function.
That can affect its function too. So you have to go in and relieve the patient of that obstruction.
Even prostate obstruction for men who are getting older, when the prostate gets bigger, it can obstruct the ureters
and then cause
this.
Cause hydronephrosis.
Okay, let's move to the next slide. Yes, cancer can also affect the kidneys. So can you speak a bit about what are the commonest ones, even though it doesn't appear that it's common? Is it common?
We've been finding quite, and then in younger age group now, surprisingly, which never used to be.
So you are finding kidney cancers
in young people.
It's more common in older people, but you appear to be finding
now
it
you're
more
finding
in young
people now. And but
what
beautiful
age group
things
is
about
it much more common?
Between 30 to 45.
Wow.
Ideally, cancers, the beautiful thing in solving anything cancer, cancers can either be benign or malignant. But they should
if it's cancer, it's actually malignant. So this is tumor.
There's some benign.
Tumor could be benign or malignant.
Yes. so when you have your benign tumors, yes, you can quickly. I mean, that poses no risk, or just take out the whole kidney. So, but any presentation really is key. In management of cancers generally, whether for cancer of the kidney or anywhere, you need to pick these things early before they spread.
Okay, so let's go next, please. The kidney infections, glomerulonephritis is, I would like you to speak more to the presentation of this from the relationship with sore throats and other aspects, because I think our viewers really need to know that this image is just for you to know that what it could look like from a healthy kidney to one where there is an infection, and the glomerulus is like where the...
So in simple terms, so to make everybody understand, that's just inflammation of the glomerulus. So inflammation of the glomerulus is like the filter.
The filter
is the major filter of the
okay.
kidneys.
Yeah.
Everything has to pass through it. It has sieves. And so when it is inflamed,
yes.
and you will have glomerulonephritis. Okay. And so you see people have, when you have settings of...
So what could cause it? So what's the relationship with sore throat?
So sore throat, recurrent skin infections can risk factors for developing glomerulonephritis, as it were. When you have recurrent sore throat, particularly in a child, that's why you don't joke with such things in children.
Okay, so
when your child is
by
having
recurrent sore throat, you mean sore throat that occurs, is treated,
and is treated,
it comes back again.
Yes, not properly treated.
Or not properly treated, and it keeps happening.
And it keeps happening over and over and again. That same organisms can cause
the streptococcus?
Yes, streptococcus.
In the form of bacteria.
The bacterial infection. That same organism can affect the kidneys, cause an inflammation of the kidneys. In fact, it might just be acute. When you say acute
is short term.
Just short term, resolves, and then you have another one again. So when you keep having recurrent things like this, on the long term, it's not good for the kidneys.
So
it can
actually
damage
lead
the kidneys
to chronic,
and
longer
cause chronic
term
glomerulonephritis, and then chronic glomerulonephritis, and eventually end-stage renal disease, and then the patient loses the kidneys.
And this is really common in Nigeria.
Oh, very common.
And
very common because of the infections.
Countries,
Yes.
Okay, let's go to the next, please. Yes, so just quickly, because our time is very short.
The slide says everything.
Yes.
Short-term, reversible. Beautiful thing about, that's a good thing about acute kidney injury.
Or acute renal failure.
But for chronic, it's progressive and it's irreversible.
So longer term,
not reversible, and
may require
renal kidney replacement, yes,
okay.
or dialysis.
Yes. Dialysis and replacement therapy. Okay, let's move.
Yes.
So what the kidney looks like, let's get to the next slide. Yes, this is a case of shrunken kidneys in chronic kidney disease, which many things might actually cause.
And that's what you see in end-stage renal disease.
So every case
kidney
of end-stage
kidneys are shrunken.
They can't really function
except in
again.
a few disease scenarios where you don't have shrunken kidneys and you already have end-stage renal disease. There are a few things, but in most cases, when you have end-stage renal disease, the kidneys are shrunken.
Okay. Yeah. So if only one kidney is affected, are we going to have any symptom? Or does it have to involve the two kidneys for the symptoms to show?
Well, for chronic kidney disease, both kidneys might be involved.
Okay.
At the end, might be involved. Yes.
Okay.
But you can have.
But if one kidney is functional,
you
might not has failed.
Exactly. You won't even notice. You can do well on one kidney.
Okay.
You don't necessarily need the two kidneys to be functioning. One kidney can subserve.
Well, God knows why he made it two.
Exactly.
Okay. So let's quickly go to the next. I think we are getting to the end of the... Yes. So common symptoms of kidney diseases. You could take it up. Low urine output, I think we've mentioned that.
Dark colored urine, foamy urine. That's foamy urine. That's one thing you call. You ask individuals, is your urine foamy like
so the person passes urine and it's like you put detergent or soap and it's forming
a lot of
foam.
So very foamy urine.
So it's a signal that
it is
something
very
is
strong signal that there's something wrong with the kidneys.
Okay. Fatigue and lack of appetite, of course, the person will be very tired. High blood pressure, understandable because it controls blood pressure. Puffiness in the face.
Yes. Because the kidneys are not passing out enough.
The person wakes up
and then you see early morning facial puffiness that regresses as the day goes by.
Okay, I remember that stuff. So someone wakes up in the morning, the face is swollen, the eyes and all that. So later in the day, it kind of reduces. And the next day, and it might get to a point where it no longer regress.
It regress, and then the whole body consistently, morning, afternoon, night. That'll be in the later stages. Everywhere is swollen.
The one we call an Asaka, right?
Generalized
body swelling. Fluid in the lungs.
Because those are thought spaces, and abdominal cavity, the peritoneal cavity, the pleural cavity, fluid can accumulate there. Particularly since you're not passing out enough urine.
Okay, so if it's in the lung, it causes shortness of breath, frequent nosebleeds?
Not very common. It can happen in some scenarios.
Okay, I think especially in the case of glomerulonephritis, that could happen. And are there some that are not listed there that you think our viewers should note?
Well, then you could, some a very early sign.
Anemia, we mentioned it in
Yes.
the course of
Nocturia too.
Nocturia.
Waking up very recurrently, that might just even be the first symptom of chronic kidney disease. At night, having to wake up. Usually you used to pass urine just 3 times or just once at night, but now you're now saying that you have to wake up almost 6-7 times at night.
Okay.
It's not normal.
Okay, what if the person takes alcohol and goes to bed?
It's a different ball
Okay,
game.
so the nocturia that is not caused by
the
excessive alcohol consumption or excessive water consumption.
Intake. And then you now say that you have to wake up recurrently at night. Okay. Different from what your usual pattern used to be, is something to look out for there.
Yes. So I think next is how do we care for the kidney?
Yes.
So I think the next slide speaks to how do we. So quickly, in a couple of seconds, how do we care for the kidney?
I think we should just make it as simple as ABCD.
Okay.
ABCD. Adequate water intake.
Adequate water.
And we talked about it before. Yes. Then if you're hypertensive, good blood pressure control.
Blood pressure control.
C, have a look at your cholesterol.
Cholesterol level.
Cholesterol
okay.
level.
People who are obese.
Yes, obesity may have. So you have
the
to
kind of food we eat, junk foods also may increase it, right?
D, if you are diabetic, ensure that your sugar is well controlled. Then dietary discretion.
Diet,
good
sugar control. And that reminds me, diabetes and hypertension
are the two leading causes of chronic kidney diseases. Because and then drug abuse, particularly
drug abuse.
Yes.
Agbo, does it have relationship?
Yes, because some of them are excreted via the kidneys. So you have to be sure what you're taking is not nephrotoxic, not damaging the kidneys. So you need to be sure.
Nephrotoxic reminds me of aminoglycosides, genticin,
all those medications.
So for those who abuse antibiotics, some of these antibiotics actually have, effect on the kidney if not taking the
right dose. So that's why I said simple as ABCD.
Wow.
If you do that.
Thank you so much, Dr. Ade Faponle.
Thank you very much
for being on the program and speaking about the kidney, the care, and the management of kidney diseases.
My pleasure. Thank you for having me.
And thank you very much, our viewers, for joining us on the program today. I know some of you may have certain questions to ask. Please feel free to do that on our social media, through our social media handles projected on the screen, also WhatsApp. Please don't call us. In the previous programs, a lot of people tend to call. Imagine if we have 10,000 calls out of millions of persons who view these programs. We'll spend all our time taking those calls. Just send WhatsApp messages, we'll respond to. And if you have any problem, please, we are not providing consults or attending to patients through this program. This is just to educate you. If you have any issue, please see your doctor. They will get you assessed and treated. So same station, same time next week. We hope to see you again. Bye for now.